Can I benefit from bariatric surgery? That is the question. Let's talk about it. Hello everyone, this is Dr. Mimi Tan. I'm a bariatric surgeon, and this question, I know a lot of folks have this question and have thought about this question. And even if you haven't thought about this question, this might be something that's an educational exercise for you. And that is, would I benefit from bariatric surgery? Now, I think there's a very common misconception that bariatric surgery is only for the extremes of weight. You have to weigh over 600 pounds for bariatric surgery to make sense. And that is actually not true. Most of my patients are far, far, far less from that 600 pounds. So if you are wondering if you might benefit from bariatric surgery, I have a pretty simple exercise for you to walk through. First thing to do is take your current weight. All right, take your current weight and take off the last number from your weight. So if you currently weigh 200 pounds, take out that last zero from the end and just stick with the 20. All right. Now multiply that number by 3. So 20 times 3, that's 60. That is going to be a rough estimate as to how much you might lose with bariatric surgery. And so think about, if you lost that much weight, would you feel better? Would you feel more healthy? Would you feel more active and more energetic? Did you used to weigh that much at some point in your life? And did you feel better at that time? And if your answer to any of those questions or all of those questions is yes, then bariatric surgery very well might benefit you. And so my recommendation, if you answered yes to any of those questions, is to maybe bring up bariatric surgery with your healthcare provider.